slim, beautiful, long. Now you are the one that puts 3 children there. Her shape has changed. She has used family planning. The Lord has enlarged her coast. It's you. It's your own work. It's your handwork. So you cannot use it as excuse. Then for some people, it's their own perception of themselves that doesn't allow them perform. Next slide. Issue of confidence. Low self-esteem. Unrealistic expectation. When you create it, you will not meet that time. Today, I'll finish you. 30 minutes. I'm not sure you reach 3. Because you are creating what is not realistic. So, but we have physical issues. Diseases that can cause it, from hormone to brain spinal cord problems to prostate problems to drugs. People that are using drugs. All this, I'm trying to expatiate them in case I'll touch whatever is part of the problem that may be on your mind or somebody that you know. Next slide. So how do we treat it? You notice all our treatments when it comes to male sexual dysfunction. 2 things we like to do. We like to counsel people in details. And then number 2, we like to sit down with the couples. The couple, husband and wife. The problem may just lie with the wife and not even the man. So if you don't come with the man, the wife, usually you may miss the origin and then you can't solve the problem. For premature ejaculation, there are so many maneuvers we can do. I can't explain too much of them, but we do maneuvers before we think of drugs. Next slide. Delay ejaculation. This can be terrible. This can be distressing. Generally, the timing we give to men to stay when they penetrate is 4 to 10 minutes. That's why we say 3 minutes and below, we are not comfortable. But anytime the thing is getting 25 to 30 minutes and more, we are worried. It is defined as delayed ejaculation. Next slide. Many people don't give attention to this because few people encounter delay ejaculation. What people usually encounter is what? Early or premature ejaculation. Similar problems. The problems are not different from age related, like that. Next slide. I just want to highlight the key things before we move into question and answer. Next slide. The same method, sex therapy, counseling, discussion. If lifestyle modification does not change it, you now think of drugs. If drugs does not work, we start talking of surgery and other higher things. Retrograde ejaculation. I mentioned it earlier. What is it all about? When a man ejaculates, because the way out for urine and semen is the same, true or false? So, where semen comes out from is somewhere around the urethra behind, around the area of the prostate, while urine comes from the bladder. So imagine 2 people sharing a pathway. One have to wait for every time for the other one to use it, isn't it? And that's why when a man is going to ejaculate, urine can never come because the body naturally locks the mouth of the bladder. That's what happens. And then the semen enters from this, a part earlier than the bladder, and then the muscle contraction we mentioned earlier pumps it out. But what happens in this condition is that while semen is entering into the urethra, the neck of the bladder, the mouth of the bladder that should close so that pressure will be enough for this one to go out, remains open. And matter naturally looks for the part of low pressure. So instead of the semen to come outside, it runs into the bladder and mixes with urine. That's what happens in retrograde ejaculation. So, common with people that have diabetes, poorly treated. Surgeries, like prostate surgeries, you are using drugs for prostate conditions, you notice it. Medical, so there are some drugs too that can cause it, like I mentioned. Next slide. So, it's good to mention it so that you know that something like that exists. All these are male sexual disorders. Now, retrograde ejaculation is often not harmful and may not require treatment unless it is beginning to affect fertility or sexual satisfaction. We don't bother pursuing it. Next slide. Painful ejaculation. It is not normal to have sex and have pain. And then It is not normal to be ejaculating. That period when semen is coming out and you're having pain. The commonest cause of that is prostate inflammation. Prostate inflammation. Next slide. So from prostate problems to nerve to infections to medications, they can cause ejaculation to be painful. Next slide. I don't want to spend too much time here. Next. We go to another one. Post-orgasmic illness syndrome. This is extremely rare. But I want to mention it in case somebody mentions it or you know somebody that it has happened to. Because guys, they just call their friend, oh God, see what happened to me, oh, this is this. If you hear something like that, say something. Okay. So what does this mean? It's a rare condition characterized by a range of physical and cognitive symptoms that occur after ejaculation. So a man finish having wonderful good sex with his wife, and then the next thing he start having flu symptoms. Nose start running. Something is wrong. All usually within 30 minutes. And it can last for a few days. He start having what looks like allergy. That's what we call post-orgasmic illness syndrome. Many people don't even seek medical attention because they cannot even associate it with the sex. But anybody that can identify that it is any day I have sex, this trouble happens, then we can treat it. Next slide. So it's a problem of allergy. Look at the symptoms. Fatigue, extreme tiredness, fever. You finish having sex, within 5 minutes, fever. You that nothing look like anything like that. Muscle ache, headache. These are the flu-like symptoms. Allergic symptoms. Your nose start getting congested. Watery eyes, rashes. Difficulty in concentrating, irritability. These are symptoms that can follow in this very rare condition. Next slide. We can treat it. Your own is to identify it. Because if a patient does not complain, can you find out the problem? You need a complaint. Then the doctor will say, oh, that's the problem, we can treat it. So I've mentioned 6 male sexual dysfunctional problems. And then I think we can begin to discuss. Let's conclude. Next slide. Male sexual dysfunction is a complex issue with diverse causes and significant consequences on the couple, their relationship, the society at large. Awareness of ongoing conditions is important for individuals. When you are aware, individuals can then seek the correct help. My problem is where people go to seek help from. You should be able to know that wherever, anywhere you have a federal medical center, anywhere you have a teaching hospital, there are specialists of different fields. So if you have a challenge, push yourself towards those places because not all doctors treat everything. Doctors specialize in different areas to attend to particular problems. And these problems we discussed today can be addressed by a urologist. U-R-O-L-O-G-I-S-T. Urologist is a doctor that specializes in the area of the urinary tract system and male reproductive system. The feeling of fear or embarrassment is a major reason why most men fail to seek help, or they do so wrongly. Early identification, comprehensive assessment, and tailored treatment are crucial for improving outcomes and restoring sexual health in men. All men should visit the urologist for any form of sexual dysfunction. Thank you. Questions and answer. I think we should take all the questions at once. Can I write so that help me with the pen?
Good evening, sir. Good evening, everyone. Thank you so much, Dr. Badele. That was an awesome presentation. I have few questions. Considering my field, all right, an arm of our organization is into marketing.
Thank you.
And then we have been doing this, we have been into this for over 5 years now. And based on my interactions with customers for now, for the past, I've had series of conversations with over 5,000 customers, across the nation. And then some of their questions, do centralize on what we just discussed today. And, when I heard you be treating something like this today, I found it very interesting to attend. So, thank you so much, sir.
You're welcome.
Yes, my question is on the place of oxygenated blood and the oxygenated blood. When it comes to, because the other time you talked about the flow of blood to the penile muscles, which would then result into the erection or proper erection. And then I also realized, that is from my own findings, even though I studied microbiology anyway, not related to your field fully. So I also know that it's not just about the flow of blood to the penile muscles that will result into an erection, but rather the flow of oxygenated blood. The blood must carry oxygen in order to sustain an erection. Because some of the questions, we market different products, which ranges from health products to non-health products for companies. All right? And then some of them will tell me that at times they may have erection, but the erection does not sustain them. Maybe 1 minute it falls off. Then I consider that to be the supply of little oxygen. He has erection. All right, that means there is a flow of blood. Then the reason why he could not sustain his erection is because the blood doesn't carry enough oxygen that would sustain his erection. So I would like to have, as a professional and as an expert, a consultant, I would like to, have your own view about the place of oxygenated blood and deoxygenated blood when it comes to erection. That is one. Secondly, for the female, most especially to some of the women who have given birth 2, 3, and then some of them, because of the way of life, they already have their vagina enlarged. All right, so the space is already large enough, and then some of them get so, they see any of our product and the colors. All right, and then how the product could help to tighten their vagina, such that, because some of them will tell us that their husband gets to complain. Their husband complains, and then vis-a-vis, and then from there, they now realize their husband is already looking out for all these young girls. Okay, but one of the things that some of them don't know is that some of these young girls also, who are not married, are also having the same, enlarged vagina, because, we do receive calls from everywhere, both from married women and the single ladies. So that's one of the things they don't know. I sell to them. We recommend to them based on the product we market. Okay. And then, I want to ask, what is the place of rejuvenation? All right. As it relates to female now and their vagina, the place of rejuvenation. So how does this help, in tightening or in posing a tightening of their vagina? Okay, though oftentimes we get to recommend gel, okay, vaginal tightening gel, we tend to recommend it for them, to them, and then some of them, when they use the product, wow, they're happy, and then we see recommendations. Then the last question are some of
Okay.
the last question, a customer called sometimes last year, and then he told me categorically that he had operation. Yes, he had operation in his manhood, and before then he was having erection, but ever since when he had the operation, his erection just went off. And then he has consulted various hospitals and then various doctors and all. So coming across our product, he requests to know if he can get surety, on the possibility of the product, giving him erection that he's looking for. This is just few amongst many. What about a guy of 24 who called us that ever since when he got matured, he knew himself to be matured enough. He had never experienced an erection. So when I asked him further, which I already got from what you said, all true, he said he has diabetics, which happens to be an hereditary.
Oh. Question, yes.
All
Moderate the questions for us, please.
Thank you so much for that wonderful presentation. My own question is, when on treatment now, because we talked about exercise, reduce fat, weight, and the rest. What about implants? Is it possible for the male?
That's all the questions.
Thank you so much. So, thank you so much for the presentation. I have few questions, and maybe the third one will just be a request. First, I want to ask is it okay to visit a urologist for just normal consultation, because we do general tests. Go to hospital maybe one time in a year, you do certain tests, your teeth, everything. So in this case, I have never done that before, but it's quite clear that probably we might need to visit. How often should we visit? This is my first question. The second question is there any position that is suitable for couples when they are looking for a child? I mean, I'm just wondering, because I have two kids already. It's not like this is a pressing thing, but I'm just wondering if there is any position that is suitable for. The third one, which I said may be a recommendation, you actually mentioned the role of communication between spouse and to better understand each. However, I want to request, if this is a series, if we can bring both couples together, I think it's going to be much more meaningful to establish some fact in every home. Thank you.
Sir, I would want to ask, we talked about the causes of male sexual dysfunction, and you made mention of psychogenic causes, but you didn't mention the effect of pornography on dopamine overstimulation and how it affects our sexual desire and could result to male sexual dysfunction in people that are unmarried and even for some people that are married still.
Yes. Yes.
Thank you, sir. The court you mentioned for the erection, which you must have the erection to be meaningful. Then, secondly, for like maybe those who do early morning studies that wake up maybe 1 a.m. and are active even till maybe 7, 8 a.m. in the morning. So, how do I even put it? Like, can they have that kind of erection can activity, can you also have direction while being active? Maybe studies, you 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 do things early hours of the morning, like you read, you 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 do research and you're up already working and you're not sleeping again till 9 a.m. So and it's expected you have erection that morning. So I don't know, just balance it up, please. Thank you.
Okay.
Pastor Tunde, you can speak now. Pastor Tunde, you can speak now.
Have you unmute him?
Yes, I'm speaking. I don't know if you're hearing me.
We can hear you now, sir.
All right, good afternoon. Thank you, Dr. Babisley, for that speech to present the face of election for that's the TPMP. Number two, what's the relation of central discussion with some context that does not allow for it?
Tell him to take that again. Tell him to take the second one.
Pastor Tunde, we can.
Second question.
The second question, sir. Hello, Pastor Tunde.
Second question. You should start again. You should start again. You should start again. I didn't get it.
That we can
Second
hear you
question.
clearly.
Second.
The second question.
What is the place of context with sexual discussion? There are some people groups and some tribes available, and discussing it look like a taboo, look like, what are you talking about? What are you talking about? Yes, so how do you navigate that? Number three is, how do you bring this topic to the young people that are intending marriage so that they are properly schooled with sex education so that both parties can get satisfaction? And finally, please, can we get to a slide? If you don't mind to share your slide. I've asked series of this discussion that we had and never got one. So if we can just for one piece of the school so that we can help other people, that's the demand. Thank you. Good afternoon.
Sir, did you get?
Good afternoon.
Sir, did you get the question?
Good.
Okay, the one on the question.
Good.
Okay, the one on Zoom there is clear.
Yeah. So I can talk now.
One more question. Okay. Someone wrote this. It said, "Is blowjob part of sex?"
Okay. Thank you very much for all the questions, recommendations, and comments. What a great job you have given me this evening. Let's see how we break them down. Number one says the place of oxygenated blood and deoxygenated blood when it comes to erection. So basically, when you understand what normal erection is, then these questions will be answered. Erection in a man has 6 phases in quick succession. But basically, it starts with the psychological aspect which involves fantasizing, allowing the mind to work. Like I said, sex has a physical and psychological component. So immediately a man starts desiring, and so that psychological aspect comes with the desire. You desire your wife. You are planning that when she comes from work today, or a woman is thinking about the husband when he comes from today. So you're already preparing your mind. That's the psychological aspect that makes it sweet and easy. So immediately that thought begins to come and you begin to transmit it into physical contact. 6 phases at a man goes on simultaneously, involving blood inflow into what we call the corpus cavernosum of the penis. The corpus cavernosum are 2 tubes within that penis. The corpus spongiosum is the third tube which your urine pathway channel runs through. So we have two major tubes that are on the top of the penis that have what we call sponge, sponge that you use in kitchen. It has holes in between. So veins form what looks like small, small holes within that sponge-like nature of that muscle. And so the blood that comes from your heart is oxygenated blood. When the heart pumps blood to the body, isn't it? It pumps it into arteries. So we have a particular artery that supplies this tube in the penis. So automatically it is oxygenated blood, whether you want or you don't want, that will enter the penis. So the issue of oxygenated blood is established. Now once oxygenated blood enters the penis, there is a body mechanism that puts a lock behind that entry. So the penis becomes turgid, erected, increase in width, increase in length. Meanwhile, there's a lock, a valve mechanism that blocks that entry. Now, this is coordinated by the nerves and psychological components and different things. Maybe drugs. Whatever people do to elongate erection can make this erection last longer than normal. Or the psychological training a man that has given to himself. Now, after these 6 phases run in quick succession, and the man ejaculates, naturally it releases that valve. And then through the veins, all those blood drains out, and that's why the erection drops. This is what happens physiologically. So, but the issue of desoxygenated blood happens if the erection fails to come to an end. And I described a condition before you came in, which I call priapism. Priapism is persistent, prolonged, painful, purposeless penile erection. Usually more than 4 hours. So any erection that fails to come down, anything 2, 3, 4 hours, we contain deoxygenated blood. And then we cause pain. So, but within the short period of normal sexual intercourse, there's no issue of deoxygenated blood doesn't come. So, the valve opens, the oxygenated blood goes in, it finishes its work, the valve deflates, it comes out. That's normal sex. So anything that causes erection not to come down will lead to priapism, and priapism is very painful and contains the oxygenated blood. It is that the oxygenated blood that causes pain. So essentially, your question is, what's the place of oxygenated blood and deoxygenated blood when it comes to erection? The oxygenated blood usually should have no place. Whenever you find the oxygenated blood in erection, it becomes a pathology, abnormality. Usually oxygenated blood performs its function and then the blood comes out. So maybe there are products that are targeted towards more oxygen, which will help. Maybe that's what your product does. I don't know much about that. But this is the normal physiology. Now when it comes to females, usually a lot of men complain. Of course, childbirth, imagine your 3 kg baby passing through that same channel. There will be some laxity. And then the more the childbirth, the ligaments that hold the vagina, because ligaments, other structures, they become lax. The muscle itself, because of recurrent childbirth, that's a major work, not because of sex. The major relax. And in some women, we have what we call prolapse, ureterovaginal prolapse. Not only the vagina, the uterus itself begin to prolapse and fall even out of the vagina when it's very severe. So naturally, age and recurrent multiple childbirth causes the vagina to lax. What do people do? There's what we call Kegel exercise. Kegel exercise for the perineal muscles. Usually ligament muscles are the structures that support the vagina. So if you put them into exercise regularly, especially for young women, and as you give birth, maybe when we have another session with women, we'll discuss all those pelvic exercise and training. If that is not enough, people have used a lot of things, minor surgeries, raise sling around these drugs, you mentioned gel. But ultimately, for some people, what they do, and even some young people, especially when they want to marry, and common in these our environments, they come for surgery. We do some work there, everywhere becomes tight again, as if nothing has happened there before. So various grades of intervention can be given to it. So it depends on what people want. Operation on the penis following, erection problem following operation on the penis. Is that what you asked? The question I'll ask is what surgery was done? Because that would help me know why the person is having problems. So you can expect it. Oh. Is he in Nigeria? Because me, I've not seen one as a urologist. Okay, so the issue is that we cannot help this man because we don't know what he had. But generally, there are surgeries that can cause erectile problems. There are surgeries that can cause erectile dysfunction. There are injuries that can cause erectile dysfunction. Let me give you an example of surgery in my field that can cause erectile problem. If a man develops this thing I call priapism, for the next 1 hour, 2 hours, erection refuses to come down. If you come to me, usually I will make that diagnosis at 4 hours. I'll try some non-surgical method. Give you fluid, give you 1 or 2 things. If it's not coming down, within a short period of time, I will remove that blood from that penis using a syringe. I'll drain it out. I'll not tell you so that I not go and do my job. So when I drain it out, usually it will drop. If that happens and you don't come to the hospital within 24 hours, that may make me do a higher surgery to relieve that. Because when you pull out that blood, it will drop as if it has bowed, then it becomes proud again. It will come back. So I have to do something more radical. Yes. And doing something more radical may affect erection itself. Now, coming late beyond 24 to 48 hours itself can damage those tubes I talked about. So it's not even the surgery. We have seen people that came to us 5 days with erection. They are trying garagaja up and down, trying traditional. 4 days, 3 days. What are you doing with erect penis for 3 days? And you are in pain. Remember, it's the oxygenated blood. So they are usually in pain. So when you come like that, we sit you down and say, we are going to intervene, but it's not the intervention that will cause your erectile problem. From now upwards, you will have erectile problem, erectile dysfunction, because that deoxygenated blood will damage and cause scar within these tubes I mentioned, corpus cavernosum. And that thing is supposed to be elastic. Taking blood, pump out blood. Once it becomes scarred, that elasticity is lost. That is the erectile dysfunction. So that's one way. Then if you have injury to your pelvic bone that damage the urethra in the region of the prostate or what we call the membranous urethra, it can damage blood vessel and damage nerve. So that nerve injury can cause erectile dysfunction. But don't forget, the urethra has been injured. I have to work on it. For me, I'll go there and remove scar tissue and rearrange it. It is not my surgery, it is the damage from nerve that will cause it. So there are several factors that can cause injury, and there are some surgeries that can affect erectile function. So for that person you mentioned, we cannot discuss his matter because we don't know. Yes, people go for penile enlargement surgery. They should have results, not negative. Now we talked about implants for male. If you can bring my slide on. Can you bring my slide on? Very fast. I do not want to go into that because I don't want that to bother you. Implants. But it's one of the options, surgery. What do we do in that surgery? I mentioned that there are two major tubes that erection happens in them. Now, those tubes, what do? We have some rod-like structures that can be filled with water or gel. So in implants, what do? We pass in tubes, two major tubes on both sides. Those tubes are collapsible. So when a man wants to have sex with his wife, the pump is in the scrotum. So he pumps it until it becomes erect. Go to erectile dysfunction, the last page of erectile dysfunction. Number 1, erectile dysfunction, last page. He pumps the tube. Because they are implants, they will now become filled with fluid, and then the penis becomes erect. When it finishes, he deflates it, and the penis comes back. Better than none, isn't it? So those are implants. Come, go to the last page of this. Move down. Go, keep going. Treatment, yes. No, treatment. That's where I should have discussed implants, but because of time. Next. Because of time, so you can see. That's number 4, penile prosthesis. Tubular rods inserted into the penis that can be regulated. That's the implants he was asking. Sometimes, if you can identify the vasculitis or something as damaged, you can do revascularization surgery, number 5. There are people and centers that are well developed in this and they are having results. But touching all those areas is very delicate. So you need proper and more training before you start touching it. There's what we call vacuum device. We also use it for people. It's meant to inflate and create erection at the junction of the penis below, and the man will develop. It's like compressing that blood that is supposed to fill it. We use a device, that vacuum device, to generate that erection, and then the man can use it. So we have devised other means to achieve erection, and then drugs is the common one. Now, Viagra is not a drug you should be buying. I know it's a popular drug. Let me address Viagra now before we go. You're having erection problem, aging is coming, go to the specialist. Let's discuss the pros and the cons of the use of drugs. Let's find out if you have underlying problems that will preclude your use of drugs. When we have addressed it, then we'll give you drugs to use. Don't do self-medication because your wife is challenging you and you're having problems in your home. If you have any major complication, you develop stroke or the erection will no longer be useful to you. You'll be managing a fresh problem, isn't it? So no self-medication when it comes to erection. Is it okay to visit urologist once in a year? Perfectly okay. There are many more things we can discuss with you. I used to say to people, when you have money, that's the time to visit your doctor, because you need long life to chop the money. Try to visit the doctor because you need to live long enough to enjoy the money. Start looking for unseen troubles, because what usually cheats people is that they have made the money now, then all the problems start coming up suddenly. They start struggling and using the money to manage the problems. Start looking for possible problems. During one of our medical services, I explained extensively what you can use your money to do. Screening tests. Come, let's go around, tell you can do this, you can check this every 6 months, check this every 1 year. For example, one of our major headache in urology is prostate. So if you come to us, 45 years, 50 years, usually the standard is 50 years. We tell you once in a year, do PSC. It's one of the things that can trouble you from eating your money. Don't forget that urology is only a tiny part of medicine. That's where the problem is. Other specialties, if you go to them, they will tell you what you are supposed to do. So usually, who you are supposed to visit, who are you supposed to visit? Your family physician. The family physician is like master of all trade. He's going to put everything together and tell you, okay, do this, this, this. Based on what he's finding, he will now send you to who is more relevant at that time. So family physician. But if because you have access to a urologist, you want to come, please do. Position suitable for couples looking for a child. Me too, I'm looking for that position because I'm not very sure. I'm not very sure what position. Maybe I should Google it and find out myself. Because to have a child, all you need to do is to drop it where it can travel up, isn't it? So, but I noticed one day I was in my call room I was a registrar, my senior registrar. So I heard him laughing because he and his wife, he said he's a victim of it. That he said when he finished during the early years of their marriage, the first maybe 1, 2, 3 months, when he and his wife finished having sex, of course, people are looking for children. So the auntie of the wife have told her, when you finish, put a pillow under your waist and raise your 2 legs and wait. But it's okay, it's okay. Maybe it's exercise. I don't know all these your formulas, where you got them from. So I now found out that it's a common thing they tell people regularly everywhere. Which kind of wahala be that? The thing that he has life, that cell has life, it will travel by itself. It doesn't need assistance. It's called spermatozoa. It has mitochondria. It has strength. It will travel and go and look for the counterpart. And it knows the road. You don't need to direct. No traffic is required. That cell knows the road. It will find, there in the fallopian tube, it will find the egg. So all those funny things you do, I don't think you need any, there's nothing peculiar about raising leg, spoon, table, missionary, all of, the thing will reach destination, isn't it? Maybe the position is for enjoyment, not for conception. Requests, the role of communication. Yes, maybe we can organize another session. Let me surprise you, there's what we call female sexual dysfunction. Young people of King's Assembly, they have eaten this thing that you are eating late. Young people, those preparing for marriage, we have done both male and female in details. So maybe there will be another time we have everybody together, maybe we'll do female. But today is for male. Effect of dopamine on pornography. Yeah, thank you, that's important. Now what will pornography do to a person? Pornography will raise the bar beyond your partner. So you are likely to have issue of sexual drive. Once you start involving a partner outside your wife, which is supposed to be the normal, pornography, masturbation, those 2 things, what they do to you is they will raise the bar beyond what your partner can ever meet. So the satisfaction you achieve when you masturbate, or the satisfaction you get from watching pornography, you can never get it from your wife or your husband. Therefore, people tend to naturally go to where they find reward. The neurotransmitter I mentioned, dopamine, and few others, what they do to you is they leave that feeling of substance use. When you use substance, those that use cocaine, ice, you have that feeling of wow, satisfaction and reward. That's what pornography does when people get addicted. So you become addicted to pornography, that the satisfaction it brings to your brain, high up in that up there, your partner cannot produce it. So what happens? When it comes to your partner, there's no desire. So sex with your partner becomes a problem, becomes a struggle. You don't even get attracted to the partner. So it's a major setback for a man or a woman to get addicted to pornography or to be masturbating in marriage. The best thing that can happen to a man or a woman is just to find that's your husband and wife, grow together, learn together, do all your mistakes, have all your experiences and inexperiences, and find stability somewhere. That's the best thing that can happen to you. Once a man starts comparing his spouse to something else, remember sex is psychological. Some people are having sex. Can you imagine that they are thinking about their ex inside that sex? Oh yes, that's how bad it is. Because the satisfaction that ex gave maybe 3 years ago or 2 years ago, they are trying to just use it to mask this one. This one is not reaching there. That's what pornography will do to a person. That's what masturbation will do. So your partner, your spouse will never ever meet that expectation. So it's a major setback on marriage. And that's why some people don't even get attracted to their wife or their husband. Now nothing is coming, because that attraction is towards where reward is coming. So next question says particular timing for post-nocturnal tumitance. We will call it post-nocturnal tumitance. Look at the name. Post means after night. Post-nocturnal means night. Tumitance means erection. So we call it, English says early morning erection. So if you notice as a young man, when you started noticing erection, it came with wet dreams as a teenager. Why? Because the hormonal levels of a man fluctuates, both men and women. But it is, we usually have a surge around the early hours of the morning, 3, 4, 5 to early morning. That's when our testosterone surges. Because the control from the brain, which are the gonadotropin releasing hormones, they surge from the brain, act on the testes, and then it surges in the testes. Hormones daily, and the time they usually surge is those early hours. So that's why you expect it any from 1, 2, 3, 4. It varies with people, so I cannot tell you a particular time you come and check. There are the things, no. Just early hours of the morning. 3, 4, 5, 6. For some people up to 7, 8 in the morning, you can still have it. So no particular time, I say 6 o'clock is the time to check. I can see a question related to that. We'll get back to that. Can activities interfere with it? I've said it's an issue of hormones. So the body is designed like that early hours of the morning, the brain releases gonadotropin releasing hormone, which surges your testosterone. Now, maybe it may distract it a little, but usually it will not change it. It remains. Whether you are working, in fact, you may notice it while you are reading. You will notice it. But your attention might not be there because the thing that kept you awake is more serious than that matter usually. Okay, so he said, what is the something of PTSD? He asked number 1 question, which I interpret as post-traumatic stress disorder. I'm trying to remember, is it the place of erection with it or... Okay, let me just describe the relationship of erection with that. Remember that post-traumatic stress disorder simply means that a person had an event that is refusing to leave him, that is leaving him with symptoms of either anxiety or depression. For example, God forbid, somebody is caught by bandits, held for 3 months, tortured every day, no food. By the time they release him, before that person recovers from the sleep, because those events will keep playing. So that's what is post-traumatic stress disorder. Of course, it can interfere with male sexual activity. Can affect erection, can affect all those things. So there's a relationship between them. And that's why anybody that comes out from those kind of traumatic stress need serious therapy, psychotherapy. But what do we do in our country? Take them to hospital one day, do tests, and that's all. You release them to the society. Why do you think the American soldiers, a lot of them are giving that attention? Once they come back from war, they are giving very detailed attention. When you see somebody blow in your front, the heart throw away, the brain pour, blood spill, will you be a normal person for several years? Boom, bah, you shot somebody, blood, bullet enter here, came out, blood gush. Those things will not leave their head for several months to years. So they need de-escalation, they need therapy over the years. Same thing, if you have any major issue of life, you need period of, and all these things, remember, is psychological. And we said sex is physical and psychological. It can affect and cause male sexual dysfunction. The place of context, people group. Of course, acceptance is an issue. If a culture or a tradition say don't talk about sex, which is where most of us grew up, the first place I heard about sex is in King's Assembly. As a young child, as a teenager. Because there's a man that is bold enough to talk about it. And we all know him. And that has shaped my life correctly for many years. He's bold enough to talk about it from the pulpit as far back as the 80s to 90s, where it is a taboo. He mentioned one day he went to one of those churches, and immediately he started it, people started walking out. How can you be talking these kind of things? But that's actually the way to address it. Those things you don't confront and address, we come back and haunt you. Is that not what we are suffering with this generation? All the small children we didn't tell at home, the ones they learned from the internet. Even the phone you don't give them, they learned it from their friend's phone. It's downloaded in their friend's phone. They are watching it in class, but they come home back to you as if nothing has happened. So this is the challenge. It's something we must confront. It's something we must discuss. And when you confront it, you have demystified it. Because there's a mystery, a hidden mystery, a lie that exists somewhere. But when you confront it with truth, then everybody's mind is clear. Everybody's thinking about it, but nobody wants to say anything about it. But if you come out with it the way it is, with the truth, you shall know the truth, and then the truth shall set you free. So that's the approach to context. Young people who are getting married, I just mentioned it, we have done it 2 consecutive years in our church. This topic, male and female, 7 weeks straight. So we prepare our young people with details like this before they get married. But I don't know of other places and other organizations and other churches. But in our own church, King's Assembly, we prepare our young people. Is blowjob a part of sex? Of course it is. Whatever you decide to do between you and your wife, number one, do it with the right person, do it in the right place, and do it in the right conditions, isn't it? Whatever two of you agree that is convenient, comfortable, suitable for two of you is okay. You lick plate, you lick cup, you lick anything, it's between two of you. Does it bring enjoyment and pleasure? It's over to you. So remember that we said there are 4 phases of sexual response cycle. And all these can be part of the excitement phase or the libido phase, early phase. So once a couple agree that this thing is not hurting me, it's not injuring me, it's not bringing negative consequence, and we are comfortable, we are good to go. Is it healthy for a man to suck his wife? We have plate has been discussed. Next. Plate, whether it's breakable or it's plastic. It's God that understands it. At what age are children expected to have early morning erection? You won't even know, sir. You just be noticing it. Maybe you are changing diapers. You'll be seeing it by yourself. The thing will just be happening. And their own can be very erratic. You don't even know morning and night. But at least you should see it. See it at intervals. Just see something. And if you if you don't see something, say something. If you see something, you are okay. A friend told me his cousin has something to describe. Has something he described as micropenis. Excellent. That's my field. Micropenis is any penis less than, I think, 2.5 centimeter. 3 centimeter, yeah. Thereabout. Solution, see the urologist. The solution is not on this group right now, or on this program. See the urologist. 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 We'll take up the matter from there. Can women experience post-orgasmic illness syndrome you mentioned? Mainly we said is after ejaculation. It's commoner in men. Not very sure that women cannot experience it. But men are the major group of people that experience this problem. Very rare. And most people may not even associate it with that immediately after ejaculation problem. You can see that there is an allergic thing, immunological basis. So maybe when I look at it in more details, but for now I am not very confident that women, because it's something that is associated with some stuff in the semen, antigens in the semen. Okay, so I think that's all the questions for now. Auntie Leah, where is she? Oh, fluorescent question. Okay, let's answer the last one. That's the reason we collect them together, so that fluorescent doesn't come. Question should not be cat question. Okay. In school? Yes. As a very young child. So his question is, what is the best time to start talking sex education with your children? The best time is when they start asking, because they will start asking early. If you shut them down that first time, they will not talk again. They will go and look for the answer somewhere else. Now you deliver to them what they can chew at that age, for age. So what you deliver is based on what they can handle for age. What you tell a 5-year-old is not the same you tell an 8-year-old. It's not what you tell a 12-year-old. You don't tell an 11-year-old preparing to menstruate. You don't tell her scanty information. No, that's the time to deliver. 10-year-old, 11-year-old preparing to menstruate. It's even from a 5-year-old that just heard it and doesn't even know the meaning. You can give him a guideline, broad guideline. Daddy like this, mommy like this, and leave it. Because it's you they believe the most. If you don't tell them okay, since daddy is not talking, then they'll go and look it out. But if daddy is talking, even if another person talks, they'll come and cross-check it with the one you are saying. Say, daddy, so person say this, but you said this. Then you have opportunity to balance it. But if you shut them down the first time, if they are very strong, they come back to you the second time, you shut them down the way they used to shut us down, our generation, and the ones beyond, the ones ahead of us. That's all. They won't come back again. I mean, they have very present things from school, they will not tell you. Because every day a child goes to school, there's something is coming with from school, a burden. And usually they want to discuss with the mother or any of the parents that is available. And then sometimes if you engage them in that discussion, you start hearing things will start filtering. You hear things like, this one say this one is this one's boyfriend. You start knowing about boyfriend and girlfriend. So that's the time you start dropping all the things you need to start dropping. But you give them what they can chew for age. Not to see a 5-year-old and start telling about, no, that 5-year-old has what he can handle or what she can handle. The 8-year-old, the 5, in fact, there are books on parenting, male children, female children, those things will help. I think that's the way we should go about it. I said somebody want to contribute to that.